It is a huge honor today to be interviewing Deborah Levin-Goldstein, who is an extremely accomplished dental hygienist. And it's just an honor that you spent the morning with me. How are you doing today?
I'm fine, thank you. And thank you for that nice compliment.
And you live in Bethlehem, Pennsylvania, right?
I do. That's where I teach, yes.
So how far is that from Philadelphia?
About an hour and a half north of Philadelphia.
And you teach at the hygiene school there?
Yes, there's a local community college, and I teach there, yes.
How long have you been doing?
34 years. 34 years.
Wow, that is amazing.
I got a job out of graduate school. I graduated in May, and I started teaching in August.
Of what year?
1982.
1982. I would have been a sophomore at Creighton University.
Well, I'm just a little bit older than you.
No, not really. Not really. We're about the same. I know women can't tell. I'm 53, but so what do you think of the dental hygiene as a profession today? I mean, you always see it, after the 2008 depression, and it really was a depression. The 1970 depression, they tried to save the dollar, and they lost a quarter of the banks, and we had 1/3 unemployment from 1932 to 36. And in 2008, we had the same depression. But they realized from their mistake in 1917, they gave up the dollar and they printed 6 trillion pieces of paper and recapitalized the banks, and it was crazy. But since then, and since Ronald Reagan's free trade, we've lost 50 million manufacturing jobs. Men have been pouring in to healthcare because it's 17% of the economy. We lost most of our manufacturing and jobs and construction. It's amazing to me. Right now, I have 4 dental assistants, 2 are men. I just go into my office manager's a man. I go into when I go to the doctor, get a physical. Are you seeing men entering hygiene school?
Yes, we've had 1 or 2 per class over the past several years. I can't say it's been any record numbers. We do see a spike in the amount of students we admit. That stays constant at 40, but the number of applicants goes up. So we can be anywhere from 200 to 300 applicants for 40 spots, and that's been consistent ever since I've been a teacher at the college.
And did they have 2 years of undergrad requirements, then they go to your program for 2 years, or do you just do a to Z 4-year program?
No, it's not a 4-year program. It's a 2-year program. It's an associate in applied science. So they can actually do everything in 2 years. It's a very busy 2 years, but they can. Most students take a year of general elective science courses, bio, micro, chem, and then they come into the hygiene program. So it's essentially a 3-year program for most students.
And what does it cost these days?
The tuition, it depends upon where you live. If you live within Pennsylvania, it's a little bit cheaper, but because we're kind of very close to the border with New Jersey, we get a lot of individuals from New Jersey coming into Pennsylvania. I would say it's probably anywhere from $2,000 to $3,000, $4,000 a semester. So it's much cheaper at a community college.
And to give away our age, are most of the ones from New Jersey, are they're young? Are they Bon Jovi fans or Bruce Springsteen fans?
Well, that depends. There are some older women who come back as a second career after their children are older and have gone to school. And there are a lot of younger students who just view hygiene as a good stepping stone. They want to combine hygiene with maybe office management. I have a student who wants to do that. She wants to run an office but do hygiene a couple days a week, which is a great,
But how much money does it actually cost?
To go to school?
Yeah.
I would say probably for the 2 years, it's probably between $8,000 to $10,000.
That's it for 2 years? $10,000 for 2 years?
Yes, and most of our students get jobs. They're getting recruited by big corporations now, Heartland, Aspen. They're recruiting our students. In fact, I just talked to my director yesterday and said, we've got to get those companies in here to tell our students what they're looking for in professional hygienist.
Well, I'm friends with, do they have Heartland out there? Do they have Pacific Dental Services out there?
No.
That's a West Coast play?
Aspen, Smile Builders.
Huh, I'm not very familiar with Aspen. I'm really familiar with Heartland because I'm really good friends with Rick Workman. You send me an email, howard@dentaltown.com. I'll reply to you and CC Rick. You tell me what you need them to do. I'll reply back to Rick, and it'll be done today.
Oh, thank you, because they're opening some offices not far from us, and students are looking for full-time jobs. That's what they want. They want to recoup their losses after hygiene school and go from there and take off. But when you mentioned the 2008 depression, we saw a real spike in students trying to get into the program because they're looking for a quick fix. A community college is like a quick fix. They say, oh, 2 years, I can do it in 2 years. It's not that hard. There's only 32 teeth, and they don't realize sometimes what they're getting into. But most students are very successful, graduate, and do well.
And what do they get an hour when they
really
get straight out of school?
I would say 29 to 35.
Wow, 29 to 35. And do you think that's held steady over your for real wages in your 30 years at it, real wages, or do you think it's the wages are drifting downwards, staying flat, or drifting upwards?
I think they're drifting slightly upwards. The closer you get to either New York, we're about 2 hours west of New York City. The closer you get to New York City, the more money you're going to make. The closer you get to Philadelphia, the more money you're going to make. In the Lehigh Valley, where we are, Allentown, Bethlehem, and Easton, we flooded the market with hygiene students. So the job, there's not a lot of full-time jobs. A lot of students get multiple part-time jobs. But students are looking for full-time jobs with benefits. That's what they're looking for. So they'll go to companies like Heartland, Aspen, Smile Builders, work a couple years, get some experience, and then maybe move into a private dental office.
So are those two guys in the class, are they just there looking for a hot woman with a great job?
No, one unfortunately is engaged to a lovely girl, and one dropped out. It was not quite what he expected, and I think it was just a little, sometimes it could be too challenging. But we've had many male students, young and old, come in the program. I'm thinking of one who graduated about 3 years ago. He's doing fantastic. He's doing very well.
The reason I say that is my dad's brother, Mike, who's still alive. The only reason he went to nursing school is because when they got out of high school in Parsons, Kansas, my Aunt Shirley went to nursing school, and he still hadn't scored a date with her. So he only signed up for nursing school so he could sit by Aunt Shirley. And it took another 3 years. She wouldn't go out with him till the third year of nursing school, and then they graduated together. So he became the first male nurse, and he still tells everybody this day, "I never wanted to be a nurse. I just wanted to marry your Aunt Shirley."
Well, we did have a student who followed another student into our hygiene program, and he later became a hygienist. But I think it was because of that other female student. But he did very well among the female students for a while.
Well, these podcasts are being devoured by dental students, and I hope that if these dental students have younger siblings that are thinking about going to dental school, I thought the dumbest move I made in dentistry is when I got to dental school, there was hygienists in the class. So they learned, about damn near everything all the way up to perio. They just had done fillings, crowns, and root canals. They had learned it all. They didn't have to study nearly as much, but what was unbelievable is that when we had a part-time job, I was parking cars or working at Walgreens for like $3.50 an hour. And back in the day, in 84 to 87, they were making $20 an hour and getting 8 hours in on Saturday. And then they had connections to all the dentists, and they knew all the specialists. They had jobs lined up. And one of my physician friends, he knew that path too. He became a phlebotomist, then a registered nurse, then a medical doctor. So when we were doing hospital rotations, he'd already lived in there for 4 years. I mean, I just can't believe that I went to Creighton University and was, doing some undergraduate, biology, chemistry, psychology, all these things that you're never going to use ever in your life. My friend up the street, he's a math major. I asked Tom all the time, I said, have you ever used math one time in dentistry? And he just rolls his eyes like, I don't know what we were thinking. So I think being a hygienist is the ultimate undergraduate degree if you really want to be a dentist or whatever. So what are your thoughts on the future? Let me say this. How has hygiene changed from when you walked into it to today?
Oh, it's changed tremendously. The just the theories on the immune system, perio, dental materials are radically different than from when I went to school. Completely different. We used to do what we call, what was quote unquote a gross scaling, and we don't do anything like that anymore. I can give anesthesia now. In fact, we're teaching students to do anesthesia. There's a lot of new products. So I think to me, it's completely different.
I think it's it's a great step forward that we can give, and that hygienists can give anesthesia and give anesthetic, and mine can. But I still think the next step to go with one person in America dying every hour of oral cancer, and a huge portion of this is related to HPV. It still irks me that I can go get an HPV, I can go get a flu shot at Walgreens, but not from my hygienist. Your hygienists are seeing all these elderly people, and they could be saying, "Hey, Grandpa, have you had your flu shot this year?" And they're not allowed to. And then with oral cancer, it just blows my mind that we are not asking about the HPV vaccine and giving it to them.
Well, I agree with you. And, that's something I've had to teach. I teach pathology, so I had to teach oral squamous cancer and divide it up now between oral cancer and oral pharyngeal squamous cell carcinoma with HPV. So that's a whole new break off of oral cancer. But what bothers me about most hygienists that I see are that they cut out, when they get out of school, they cut out the extraoral and intraoral exams, and they spend more time on scaling. And when you read the obituaries, no one ever died of calculus in their mouth. They die of oral cancer, and that's the thing that hygienists are cutting out, trying to save 5 minutes in a day. They're cutting out the oral cancer exam, and they're missing that, and they're spending more time getting the calculus on the distal of 18, and no one dies from that. So,
I want to be famous by being the first dentist to ever die of galvanic shock.
Oh, you're too much.
That's the shock from two dissimilar metals, like when you have an amalgam touching a full gold ground. Just in case any listener didn't catch that joke. But anyway, but I mean, it's amazing. I mean, why would anyone think that gum disease is more important than oral cancer when 10% of Americans at age 65 don't have one tooth in their head, including all my, half of my pedigree. And by 70, it's 20%. So you got all these fine people living with not a tooth in their head, but they're dying 1 per hour of oral cancer. What is the issue?
I understand. I think it comes to time and quality. And I think hygienists think, oh, I've got to get all that calculus off the lingual of number 25, and don't spend 30 seconds sticking the tongue out and looking in the back of the mouth, sure, in the throat area. And also what's changed too, that's one thing that's changed, but there's so many remineralizing products now. We didn't have any of these products when I came out of school. We had fluoride. That's what we had, fluoride. Yeah, so when you think about the course I just did for Dentaltown,
which has been very well received. Everybody's loved your course.
Thank you very much.
And I really loved it too.
Thank you. And these are just new products that are on the market, despite the fact that we have all these increased in scientific knowledge. We have increased commercial preparations. We still have caries. And you're talking about tooth loss and caries. Now, that's one thing that hasn't changed since I've gotten out of hygiene school. We're not putting a dent in caries as well. And these products... go ahead.
Well, no, I always tell dentists, I say, why are you high on yourself and the dental profession? Because imagine if you were retiring from the fire department, they say, Deborah is retiring, and after 30 years on the force, I'd just like to say that almost all the houses burned down. And or you're the retiring sheriff, and we say, since Deborah was the sheriff, every year there were more murders than the year before. When she started out, there were 5,000 people in this town, and now there's only 8 left. I mean, dentistry, we have 25% of the towns still don't have water fluoridation. And during that whole Obamacare, the dental community was silent by just saying, hey, Obama, dentistry is 5% of healthcare. Why don't you just get rid of all this stupid rinky-dink city council? I mean, imagine if the city councils were all arguing over the flu shot or or any of these vaccines where all these people think they cause autism, and all the what if we put all the CDC measures up for a city council vote every 2 years, and basically DMFT, disease missing and fill teeth rate, is rising over the entire planet. And so these dentists go into a community, and 40 years later, there's more cavities than when they started, and they think they did a good job. And it's also sorry to interrupt, is of the 9 sovereign specialties recognized by the ADA. Everybody talks about endo and perio and pedo, but they never talk about public health, and we're all public health dentists.
Right, sure. Caries is a public health problem. I think it's the number one reason for young children to miss school.
52 million school days are missed a year from caries, yes. And it's 8% of emergency room visits.
Right. So if you don't want to have, so if a parent doesn't want fluoride, there's a lot of remineralizing products, and they have calcium and phosphate. We have over-the-counter toothpaste. We have RX toothpaste that contain remineralizing products. We have prophy paste. We have varnish. We have gum. Gum contains remineralizing agents. Professional fluoride gels, whitening products. You can buy MI paste and ClinPro tooth cream on Amazon. So there's a wide variety of products, and all the fluoride in the world, its availability to get to the enamel is limited by how much calcium and phosphate is in our saliva. So unless you know and get your saliva tested, you're not going to know how much calcium and phosphate you have. So why not put some products in? Put some products like MI paste. You can take it on your index finger, smear it in your mouth, and add some calcium and phosphate. So when you drink fluoridated water, then you have calcium and phosphate ions immediately available for uptake for the fluoride. So there's a lot of different products. I just don't understand why we're kind of in this static state with caries. Like, I understand dentistry relies on fillings, restorations, fine. But caries is preventable, and we can do a lot more. I agree with you, to prevent decay.
Okay, Deborah, I want you, these kids are commuting to work. They're, we got about 7,000 listeners per show. They're mostly under 30. Every time someone emails me, I reply back, tell me your demographics. They're all 25 to 30. They need to hear specifically you talking to a patient. So I'm the dad, and I'm at the appointment, and my 7-year-old or 10-year-old or teenage kid is sitting there, and he's got 6 interproximal cavities. Talk to me as the dad of what products, specifics, which names, of how I could be trying to reduce caries more and remineralization.
Okay, just tell me again, how old is the child?
Make one up.
Okay, I'll put a little bit older child, okay, because a lot of products for remineralizing the enamel cannot be used in children under age 6, except for varnishes, particularly if they have a high fluoride content, because we want to decrease the amount, not decrease the amount of fluoride, but be careful about the amount of fluoride up to around age 8 until all the permanent teeth have calcified. Because otherwise, if you put too much on, you get fluorosis. But let's just take it a 12-year-old. And I would just say to you, Mr. Farran, your child has a lot of interproximal or between the tooth decay, and we can give a prescription toothpaste that contains more fluoride than a normal over-the-counter toothpaste that you buy at Walgreens or Giant at a supermarket. And we can give you, with a prescription that you can get filled today, we can give you a prescription toothpaste that your child can use at night before bed that has 5,000 parts per million fluoride, 5 times the amount of fluoride in a regular toothpaste. And so you brush with this in place of the regular toothpaste once a day at night. Okay, and then the child, after brushing for 2 minutes, and I would recommend a power brush. I don't know why people are still using manual brushes. The power brushes work so much better. And even a battery power brush is an advantage over a manual toothbrush in reducing the amount of bacteria in the mouth. And so brush with this. We can also use a varnish, which is a sticky resin-like product that contains fluoride. or some of the varnishes now have chlorhexidine in them, which is an antimicrobial that will reduce the bacteria that causes cavities in your mouth, in your child's mouth. And we can apply this varnish every 3 months. So there's a lot of other products that we can do. We can look at the way your child's eating, the frequency of ingesting carbohydrates. A lot of snacking is not good. So there's a lot of other options. If you don't want your child to have fluoride, products that contain fluoride. Some parents, Howard, I will say, are very vocal. I had a parent in last week, very vocal about not allowing her children to have any fluoride. That's fine, but there's a lot of other products that we can use. So it would depend upon whether they want their child to have fluoride or not to have fluoride, but there's a lot of products.
Okay, be specific on name brands. You mentioned the 5,000 part per million fluoride. Was that a Crest?
Yes.
Pro?
Yes, yeah, that's Clin Pro has a product that by 3M, and as well as Prevident products. They're all 5,000 parts per million fluoride. There's a lot of.
Do you like one of those more than the other? Do you like 3M or who makes Prevident? Crest?
Colgate.
Colgate?
No, I don't have any preference one over the other. No.
You know what's so funny for me for Colgate? You know how in America, when a product is so ubiquitous that it becomes the name, that the Supreme Court takes away the patent, like you can't patent the name Kleenex anymore because everybody started using it. Hand me a Kleenex, and they were, and most of the world, there's no word for toothpaste. They just say Colgate, and it doesn't matter what brand they're saying. So Colgate for Africa, Asia, and Latin America is just like Kleenex for America. And you even hear people saying Coke. I'm going to go get a Coke. Oh, you want a Coke? Well, I mean, I want Dr. Pepper, but they'll, sometimes they say that.
Yeah, and also,
and back to the varnishes.
Yes. So there's
name brand.
There's a lot of different ones. MI Paste has a varnish. Obviously, Colgate has its own varnish. Some of these varnishes contain fluoride. Some contain fluoride and or chlorhexidine. So you can apply the antimicrobial.
Deborah, when I read about varnishes, they're so overwhelming, massively effective. But when you go into offices, they're just, I'd probably get more likely to be ran over by a unicorn than see someone using varnish. Why? How widespread do you think varnishes are or not?
Well, I think, first of all, they're an advantage over the fluoride trays that some offices are still using. All right. So, you put those awkward trays in the child's mouth and they gag and then they don't like fluoride. One of the things I would recommend would be varnishes are not popular because they make your teeth feel dirty again. So we clean your teeth, at least in the clinic that I teach in, we clean your teeth and I say to patients, okay, now we're going to make your teeth feel like they're not clean. We're going to put this varnish on and you have restrictions. You can't eat anything hot. Okay. Well, that's, and then you can't eat anything hard or crunchy for about 6 hours. Don't floss in those spots. So there's a lot of restrictions, but I think the varnishes are not, how should I say, as smooth as they could be. They make your teeth almost feel dirty again. I went into the ladies' room yesterday and a patient who had been in clinic was picking the varnish off her teeth. And I said, well, it's in about 6 hours, it's gonna just kind of flake off of your teeth. She goes, I don't like that feeling. I don't like that feeling. It's not as smooth as it could be.
And some people say, they get hung up on this evidence-based dentistry, which is a good thing and a bad thing. But a lot of people are saying that if you really look closely at the research, you do not see a reduction in periodontal disease or caries or anything on 6-month recalls, that you only see it take effect at 3-month recalls. What would you say to that?
Well, I think that I haven't looked at all that research as well as probably you have, but I would say the further you get away from the actual cleaning, deplaquing, debridement, and the less compliant the client is, sure, you're going to have a buildup of the biofilm, and everything is going to go downhill from there. You're going to have increased bleeding upon probing, all those clinical parameters that we're going to see.
Practicing in Phoenix, all my patients have one thing in common. They're all compliant on their non-compliance.
Yes, it is. It is a problem. And that's another thing I teach, and it's very difficult. I think, too, dentistry is making a move. Now we have Canberra, caries assessment, caries management by risk assessment, and sort of that risk assessment model that now we're using, that you hear so much in medicine. You have so much risk of getting this disease or that disease. So we have Canberra now, and Canberra was developed by the California Dental Association about 10 years ago. The American Dental Association has its own Canberra form. Philips Sonicare has a Canberra form. Carie-free, that whole system that uses xylitol, has a Canberra form to assess risk for caries.
Is carie-free, is that Kim Cooch?
I believe so.
Who would be the best person to have a Canberra online CE course?
I would say someone from 3M. I know they have been at Dentaltown and given courses. 3M has an excellent Canberra program.
Do you know someone there? You know someone there that you could email?
Ellen, is it Neuenfeld. That's right. Ellen Neuenfeld.
How do you spell her name?
Neufeldent. No. Feld.
Okay.
F-E-L-D, I believe it is. I have it. I can email it to you, Howard.
Because that is a huge, massive advancement. And again, these things start on the coast and they'll end up in Parsons, Kansas about 10 years from now. And it's time that starts rolling in faster.
I know. Well, we encourage students now to do a caries risk assessment and a periodontal risk assessment as well. I know some of these programs are computerized. So if your office is paperless, you can do it on the computer. Ours is in a paper form where we ask the clients, do you brush with fluoridated toothpaste? Is your water fluoridated? This is your plaque score. So we're trying to combine it with risk. You're at a low risk for decay, so continue to use a fluoridated toothpaste. Don't change anything. You're at moderate risk for decay. Use a mouth rinse. You're at high risk for decay. Okay, now perhaps we need an RX product. Just as you would, you're at high risk for heart disease, so we're going to have a medical intervention. Well, now we're going to have a dental intervention.
So, do you think that another thing, it's kind of fun when doing something for 3 decades and living half a century, you see what's what's old and expires, what goes out, comes out. You kind of see the pediatric dentist on Dentaltown talking about, silver nitrates making a comeback. I mean, I think for the first time in my 30 years, dentists are becoming less mechanical engineers building bridges and houses and barns and crowns. And they're becoming more biological in nature. They're realizing that we're really, at the end of the day, we're biologists. I mean, we fight these gram-negative facultative anaerobes, P. gingivalis, Streptococcus mutans, and even that's a joke. Just to say that is a joke, because when they're dissecting out a cavity, by the time they're 4 millimeters deep into the cavity, there isn't even Streptococcus mutans, and they're discovering a new species every 3 months. So you were talking about remineralization, and you talk about 5,000 part per million fluoride and made by Prevenant or Clinpro, but you're also talking about calcium phosphate and what toothpaste products use that, and would switching from orange juice to like an orange juice that's fortified with calcium or more milk or any other things. I think too, if you're going to have a product that has calcium, you're going to swallow it. So it's a mouth effectiveness would be somewhat limited. But there are products, for example, ACP is a remineralizing agent, amorphous calcium phosphate, and that's in toothpaste. It's in toothpaste as liquid calcium. That's what it is called, liquid calcium, and that's an Arm & Hammer toothpaste. So you can provide that to someone. But one other thing that these products do is, in addition to putting calcium and phosphate into the saliva for uptake by fluoride, they also decrease sensitivity because they put a smear layer
of calcium and phosphate over the dentinal tubules. So if you're like me, my teeth are sensitive and I use Sensodyne toothpaste, and I have to build my smear layer up every day. But there's a lot of other products. MI paste is minimum intervention paste, and that's CPP, ACP, that's Recaldent. Recaldent is found in chewing gum, Trident chewing gum. So you can chew if you're in a demineralized phase. And I don't think clients always understand remin and demin either. We could do a better job with that. There's other products. Novamin is CSP. That increases the pH of the mouth, increases calcium and phosphate levels over days. So these are all products that have been developed by dentists. TCP is in a lot of the ClinPro products. And so that's functionalized calcium phosphate that is what they call SMART, meaning that the calcium is prevented from interacting prematurely with the fluoride until you're in a certain level of demin. So I'm just fascinated. These were all created by dentists. ACP was created through funding from the American Dental Association.
ACP, and what did that stand? What's the name of that company? ACP.
ACP is amorphous calcium phosphate. It's in a lot of products. Arm & Hammer, for example, has
it's. I still crack up every time I see Arm & Hammer. I still crack up. He immigrated from Russia, and he was a pharmacist in Manhattan, close 2 hours from you. And till the day he died, everybody thought he was the Arm & Hammer. They thought he was the baking soda man. And he was the founder of Occidental Petroleum. And he said, I can't get away from this Arm & Hammer baking soda. Yes. They see this rich guy in a jet. They just assume he sells baking soda. I still
have patients that tell me they dip their toothbrush into baking soda and brush their teeth.
Well, I want to go to the other end. There's a very famous hygienist named Trisha O'Hare who wrote a book about dry brushing, who still swears, she's been in this profession for 40 years. She still swears that 2 minutes of brushing is what you need, and that there's no evidence as far as removing the plaque. She says you don't need any toothpaste.
I definitely have to agree with her. And I don't think you need toothpaste. I think toothpaste does have some active ingredients such as fluoride, such as some other products, for example, potassium nitrate, that will have an effectiveness. But yes, I agree. I think you can just wet your toothbrush and brush your teeth. Your breath may not smell great, but...
Well, I don't care about my breath because I'm single, but every time I'm in the shower and the toothpaste is gone or it's out because one of my 3 boys living with me stole it, I just go through that Trisha O'Hare lecture and say, Howard, you don't need the toothpaste. You don't need the toothpaste. I just do the whole brushing, but it is... yeah, your mouth it does feel clean and all that stuff, but it just doesn't feel the zesty. I also want to talk about, there seems to be a lot of changing and thinking about caries being a communicable disease. We know that babies aren't born with it.
Yes.
We know that when a mother kisses its baby and it doesn't have any teeth, those bugs die because there's no oxygen anaerobic environment. But as soon as that first baby tooth pops out, and there's a flap of tissue laying up there, that's the first place these gram-negative anaerobes that can't live in oxygen take place, and then the baby's infected, and you still don't see anybody in the media. They always, when they talk about body-to-body disease, they talk about, sneezing colds, or if you're sick, wash your hands, and all this stuff. But nobody in the media is talking about, your husband has 10 untreated cavities and bombed out wisdom teeth, and you kiss him every night, and he kisses the children goodnight, and the mom's coming in with the cleanings, and you don't see anybody in the media talking about it. You don't see anybody in the movies. What are you teaching your kids in a hygiene school about talking to that you can't kiss a trash mouth any more than you would have intercourse with someone who was infected with an STD?
Right. So we teach them that the biofilms are communicable and the bacteria communicate. And another thing that you could recommend for someone whose mouth has a lot of untreated decay is, how about who kisses a baby, how about an xylitol wipe that you can wipe the babies' teeth with. Look, you don't need to brush the baby's teeth, but just wipe with an xylitol wipe. They make these products. Xylitol, unfortunately, it has to be effective with a certain percentage or dose, and I don't know that dose right off the top of my head. But one of the side effects of too much xylitol is diarrhea, so we can't have that. But there are wipes that you can use. And many of these Remin products, I'm thinking about one product called Remin Pro, contains xylitol. So it has has extra calcium and phosphate plus xylitol. So a lot of these products combine preventive strategies.
So who's correct? You have 3 dogs. I have 2 cats, and I don't know if you don't have. They have found out through genetic sequencing that the Streptococcus mutans that humans picked up that causes all this decay actually came from cats about 15,000 years ago in the Fertile Crescent. So do you have 3 dogs, not cats, because you're mad at those cats for getting us disease? And do I have 2 cats because without cats I wouldn't have a job and I'd have to be working at Taco Bell? Or should I?
I brush my dog's teeth every night, and I don't use toothpaste. I wet a toothbrush, and I just brush their canines and their back teeth. I do it religiously every night. Everybody laughs at me, but my dogs never have had to have their teeth cleaned. And I've had 6, 7 dogs in my life, none of them have had decay.
Well, I was raised Catholic, so whenever I hear someone say they do it religiously, that means they do it on Christmas and Easter.
No. And actually, my mom was Catholic, so I think we have a share of background there.
So you have a good, healthy amount of guilt then, if your mother was Catholic. So that is so putting on your hygiene education hat to private practice hat. A lot of private practice hygienists. You mentioned Heartland. When you go into some of these corporations, they have more protocols, and some of them that work at various corporations do not like protocols when it comes to placing chips, like Arrestin chips or different types of chips. Some people think, forget corporate, I don't even know why I said that. They work for a dentist. The dentist says, okay, if they have a 6mm pocket, you put in this chip and here's the deal. And some hygienists don't believe in it and think, is my dentist doing that because they're buying these chips for a few bucks and putting them in for a lot of money? Is it a finance thing or is it a research, this will help thing? And go over, there's many, what is there? Reston, there's
PerioChip, yes, sure, Atrodox.
So will you go through, so I want you to go through the chips, those 3 chips, and then there's some dentists still, when someone comes in and gets replaying curettage, is given a script for tetracycline, 250 milligrams a day, BID twice a day for 10 days, because, we were trained back in the day that tetracycline shows up in the gum tissue 7 times more concentrated than all the other bacterias. And then some dentists, they're so frugal on Dentaltown. Some of them buy their own canister of tetracycline, and they just open the pills into a dish, and then they wet it. And when they're done, they actually paint the tetracycline into the sockets. So talk about all those things.
Well, I think, first of all, when you talk about systemic tetracycline versus local drug delivery of some of these products, the localized drug delivery right into the pocket tends to work a little bit better because it stays there. Now it bioresorbs, so it biodegrades on its own. The patient doesn't have to come back for a second visit and have whatever it is taken out. So I think there are some advantages. We use Arrestin at my college. It's easy to place, but so is PerioChip. PerioChip is just very easy to place. Atrodox is easy to place. It's a little bit awkward because you have to mix the liquid and the powder together with your thumbs for about a minute or 2. So it's time consuming. It goes in as a gel and hardens up. Arrestin it's minocycline, and it goes in, and these little microspheres extend outward into the pocket, and they kill bacteria. And so we're seeing, I just saw a patient last week who had Arrestin placed 4 or 5 months ago. Tremendous 2 millimeter decrease in pocket depth and no bleeding upon probing.
So so would you recommend Arrested or Parachip? Is Parachip minocycline too? What is
No,
Parachip?
periochip is chlorhexidine.
Chlorhexidine. So which
Yes.
one of these two would you recommend?
I recommend both of them. I recommend anything that you can place directly into a deep pocket.
So
That
you recommend these, and these are huge hygiene builders because what most
yes,
dentists don't understand is, the hygienists bill 100 an hour. They get
right,
paid 35 or 40 hours. If you do the math on hygiene departments, most of them lose money. And
right.
if you added a few things like this, they would be in the profit zone.
Exactly. And the fees for these products are tremendous. What they charge now for us, we're very lucky that the company gives us the product to free to use. Well, we're a clinic to use. But the problem is when we run out, we don't replace them. So and we do it for a free service at my college. So, but dentists are charging much more than that. I'm hearing $40 a quad, $50 a quad. So it really depends. But sure, anything that the hygienist can do to individualize treatment would be fantastic. I think sometimes hygienists get into this mindset. Okay, I have 8 patients today, 1 an hour. Okay, 8, 7, 6. They're just starting to count down, and they're not thinking about all the things they possibly could be recommending to the client.
You mentioned that these local antibiotics were microspheres. What did you think about that microsphere controversy where the toothpaste company was putting
Oh,
these
yeah.
colorful food additives in there?
Yes.
I disagreed with the controversy because I raised 4 kids. I know you have a boy. I raised 4 boys, and I saw the spheres that, like giving them a bath. If I put them all 4 in the bathtub and there were no toys, they'd be out in 1 minute. They'd be finding out. But if I threw a bunch of boats and balls and whatever the hell that floated in there, they'd stay in there for an hour, and I'd have to keep running warm water. Toothpaste, I think if it doesn't taste good and look pretty or whatever, a kid doesn't want to do it. And I didn't really see the trade off. Like, okay, this thing was approved as a food additive, and if it makes a 2, 3, 4, 6, 8, 10 year old kid brush their teeth, I know. I didn't agree with the controversy, but did you agree with the controversy? Did you think they should be removed? Do you think that
No,
was
no. To me, I agree with you. Whatever gets someone motivated to brush teeth, and some people just intrinsically are motivated to brush teeth and like a clean mouth. That's the concept of using xylitol wipes when the teeth come in to give the baby an idea of what the teeth should be cleaned, a clean feeling. But no, I agree with you. I think anything that you can get a kid to do to brush their teeth.
and
Um,
another thing I never liked about the hygiene department that I changed in mind and I thought it was very effective is, this hygienist will see this 6-year-old kid who's never flossed his teeth once in his life. And then she does the whole cleaning, flosses his teeth and all that. And I would go in there and say, there's really no evidence that you can do something twice a year and change this kid's disease, missing and filled teeth. Like, you got to be his Vince Lombardi coach. You got to be his motivator. You got to be his inspirator. Why don't you set him up and hold a mirror and then have him floss his teeth? And then when he
right.
starts in the middle, you can train him. No. We start on the upper right so we don't miss anything. We go to the upper left, then we
Yeah,
drop
yeah, I know
down,
what
and then we
you're
come up.
saying.
I cringe whenever I see a hygienist floss someone's teeth, even if it's a 50-year-old man. I mean, he's got, you look at his pano, he's got 15 fillings in his mouth. Everyone was an interproximal filling and MOD from not flossing. He's got recurrent decay under these MOD amalgams. He's got, and the other thing about probing, I made them probe differently. I said they had to probe the buccals and linguals first. Say, okay, first I'm going to probe the gums where there's air, where there's 20.9% oxygen, where the bugs have a hard time growing, and it'd be like 3, and all the way. And I say, now I'm going to probe in between the teeth where there's no oxygen, which, by the way, of your 28 teeth, you already have 12 flossing fillings in between teeth. Now we're going to floss those and be like 4, 5, 4, 5,
Yeah.
4, 5. And then they would just, and then I'd say, okay, let me see you floss. And then you could tell, they weren't even rolling it on their finger. You could just tell these people have never flossed. And I just think the whole hygienist mode is that I got to get in there and remove all this plaque. I got to get in there and floss. I have to do all this stuff. They're believing too much of their own hype that they can go in there like Obi-Wan Kenobi twice a year and knock out this disease with a lightsaber. And that ain't it. You got to be a motivational coach. And when I would have moms come back and just rant and rave, they say, oh my God, ever since I started coming here, I tell my two boys, they're 4 and say, okay, time to go to bed. And they go, oh, I gotta go floss, Missy. And then they stand on the stool and they're talking about their hygienist, Missy. And she goes, oh my God, now I got to put them to bed a half hour earlier because of Coach Missy. They're going to run in that room, stand on the stools and do this whole routine. And they weren't doing it for their mom, their dad, or their dentist. They were doing it for Missy. And I just thought, I just think the whole hygiene mentality has to change that. I'm not going to do anything twice a year to change anything. Same thing with bypass. Have you seen the studies on bypasses of twins where one person gets a $100,000 bypass and the other one, due to health insurance, couldn't afford it, but he changed his behavior, quit smoking, lost 40 pounds. And the one who didn't get the bypass but quit smoking and lost weight and all that lived 3.5 years longer than the one who got the $100,000 bypass. And when I read that, I mean, how many times have you seen that with 4 quads of gum surgery? You do 4 quads of gum surgery, 4 quads of replaying curettage. They walk out the door. Nothing changes in their behavior. And 1 or 2 years later, they're right back at square one.
Yeah. And I think part of the problem is floss isn't always the answer. Flossing is hard. So, okay, so we have a lot of different floss products. What about a Waterpik? They're called water flossers now. That's what they're being marketed as now. They're a great alternative. There's air flossers that use that little puff of air between your teeth. Look, whatever you do interproximally, it doesn't always have to be floss. That's what I try to emphasize with my students. We could use end tufts, little interdental brushes. It doesn't always have to be floss or flossing, which is a difficult skill. In addition to a manual toothbrush, okay, now we're going to use the modified bath method of toothbrushing. That's difficult. Why don't you just buy a power toothbrush and brush your teeth with a power toothbrush? It's much more effective. It removes more biofilm. It's rotating 30,000 cycles a second. I mean, why not just use that? It's so much easier. It shuts itself down after 2 minutes. You don't even have to think. You just sit there and move the brush. You don't even really, the brush is working. You're just moving it from tooth to tooth. So I agree. I don't think you always have to use floss. There's other devices that we can use to clean interproximally.
And by the way, for my fans back in Kansas, when she says the modified bass technique, that's the modified catfish technique. So just if you didn't catch that. So what toothbrushes do so let me say this succinctly. When these companies started claiming that they were a substitute for floss, a lot of dentists and hygienists went literally batshit crazy. I mean, they were jumping off buildings. Is there any product specific names that really is a substitute for floss? Because we all have a ton of patients say, I hate to floss. So if someone says, I hate to floss, can a dentist or a hygienist say, use this and it's basically the same effectiveness?
Well, I think you look once again.
That's the only question I asked that made you stutter. You're like even you didn't want to go there.
No, I think you could use a Waterpik. I don't want to commit because I don't know the research as well. But I would say to a patient, try a Waterpik, try a water flosser. And there's certain regimens you have to follow with that. Look, you can put an antimicrobial into the reservoir and shoot the Listerine between your teeth as well at the same time. I think that's very effective at removing biofilm.
I think the biggest problem with the Waterpik or water floss or whatever is all their marketing and advertising is sitting it on some pretty woman's kitchen or bathroom sink. And women hate it because, I mean, they go nuts when you leave the toilet seat up, let alone leave a bunch of water splashed all over.
They have them that fit into showers.
I know, and that's the one I love. They have to be in the shower. No one cares where there's water in the shower. And if everybody marketed it and said, oh, put it in your shower, because they don't think about that. They just think of the water spots on the mirror. Their pig husband left the toilet seat up.
Yeah. It is messy. Yes.
So just move the whole thing into the shower. In fact, my favorite is the shower floss. You unscrew your shower head, You put it on there. It hangs down. There's got 4 colors on there, and me and my boys, no one knows which color's who, so we're all using everyone's, and it's fantastic, and the boys loved it.
But I think that's a viable alternative. I really do. The air flosser, the little bit of research that I read, it's very effective. We even have those little tiny, they look like very small interdental brushes that go between the teeth. So once again, we don't have to always use floss.
Let's go on to toothbrushes. You still go into every grocery store and they have soft, medium, firm.
Right.
It still seems like, do you still believe that you have to use soft? I mean, there's just still a gazillion. I mean, there's 330 million Americans, and still a huge portion of them think if it's a Brillo pad, if it's wire bristles, what do you see in toothbrush effectiveness?
Well, certainly, yeah, sure. You can find hard bristle brushes, and you have people that use them and have recession. A lot of times, individuals say to me, "The soft ones, it just doesn't work. It doesn't feel like it's doing anything." And once again, I will say to them, "Then, if you don't feel it's effective, try a battery-operated brush or a power brush. It's going to be much more effective at removing the bacteria in your mouth."
And which brand do you recommend?
I like Sonicare. I have both. I have Sonicare and Oral-B. I switch off all the time. Some days I use a Sonicare. Some days I use my Oral-B. It depends upon where I am in the house to use them. I have them at school, and I take them into the bathroom at school and brush my teeth with them there. I don't use manual brushes.
I know you're my idol because you're a hygienist talking about power toothbrushes like most women would be talking about their handbag. You're talking about these, whether these are Gucci or Prada or Louis Vuitton.
I think a battery brush is a very good alternative.
So then go mouthwashes. Wasn't there a mouthwash? Wasn't it Listerine saying about 5 years ago that a minute of Listerine, switching to a minute of Listerine was equivalent?
Saying that, yeah.
And who they get in trouble from? And do you think? I mean, they obviously had research. I mean,
I believe it was the Food and Drug Administration said it has to be labeled as an adjunct to or in addition to brushing and flossing. It can't claim to be a substitute for brushing and flossing.
Oh, it was brushing and flossing? I thought it was just flossing, but was it brushing and flossing?
It might have been just flossing.
So what do you think about the 27% alcohol in the mouthwash for cancer? You know, some people say you got to be alcohol free. You got to be alcohol free if the person's used to be an alcoholic and they're afraid of that, and it's got to be alcohol free. Some are saying for oral cancer. Then you got other people who are saying that no, alcohol causes cancer when you're swallowing it and you're running it through the liver, and it's the changes in the liver that causes oral systemic cancer. It's not if you soak your finger in Jack Daniels every night, you're not going to get finger cancer. You have to drink it.
This is something I have read the research on because I do teach this. And as far as I know, there's been no research to prove that using alcohol in a mouth rinse causes oral cancer.
And I never bought the cancer model the first time I took pathology in undergrad, because they talk about these toxins like alcohol and Listerine, or they talk about all these things. I said, well, you know, every time you talk about that stuff, if I just applied it to a room full of rabbits, the rabbits would all die, or the mice or the gerbil. But that's not what you see in cancer. You see this rabbit who's multiplying every 20 minutes and growing. So if this is a carcinogen, we should all be eating this stuff because it just makes everything grow. I always knew something is hijacking the nucleus, getting into the DNA and turning it on to just start going into hyperdrive. So you know, putting a toxin on your alcohol doesn't make any sense, but running it through the liver and then tearing up a big part of your immune system and your health and functions, and your body's weak and then goes immunocompromised and then gets taken advantage of. That makes sense, but not soaking your finger in alcohol, then the cells just go cancerous. They would die. They would turn to white. They'd fall off.
Right. But there's a lot of look. If you don't want, if the alcohol bothers you, and it might bother a mother with a young child, look, use Crest Pro Health. It's alcohol free. So
now, I'm old school. I've been on
essential oils, but yeah, sure.
I've been on Listerine since I think I was 10. My mom and dad weren't listening. I still use the same cologne as my dad, the same mouthwash as my dad. Here I am. He's been dead 16 years, and I still use all of it, the same, all those brands. But I just don't feel clean unless I swish for a minute with Listerine. And I do my minute by, when I'm done, I put that in, and then I'll go put on like my underwear, shoes, socks, and so I know that it's been in there for 1 minute. By the time I've turned the coffee pot on, I spit it in the sink. Do you use mouthwash? Do you use Listerine? What do you think about mouthwashes?
I don't use mouthwash. It always, I don't particularly care for Listerine only because it stings when I use it. However, I have some recession, so I do brush with Prevident 5000 Plus, Booster Plus, every night because I do not want to get root decay. So I do brush with extra fluoride.
And isn't that funny how that's psychological? Because when I use the non-fluoride or the Act, with fluoride, and I use that, and I don't get that zing burn on my walnut brain thinks nothing happened. But when I'm sitting there and my eyes are watering and I spit it out and gasp for air, my walnut brain thinks, oh, you killed everything.
Well, a lot of offices use Listerine as a swish for a client to reduce the bacteria in the mouth during aerosol procedures, like they're using the ultrasonic or polishing. So they're reducing. It does reduce bacteria in the mouth very effectively.
I wish hygienists would think of another thing that I've noticed day in and day out for 28 years is when back in the day, it was in '87, and this little Arkansas company called Omni came out with the bleaching.
Yes,
and it wasn't even a month or a year before I started realizing that Americans, or humans, they're all or none. I mean, you either haven't gone bowling in 5 years, or you own your own bowling ball. You either haven't gone to the lake in 10 years, or you own your own boat. And it's the same thing with oral care. And what I noticed is that when people started getting braces or bleaching their teeth or taking out amalgams, putting in composites, they got into their teeth. Yeah. And as soon as they liked what they saw in the mirror, they started taking care of it. But when they didn't like what they saw in the mirror, they didn't want to think about it or deal with it or brush and floss. I still think bleaching and bonding in cosmetic dentistry and orthodontics and short-term ortho and anything that makes them motivated to say, oh, I like my teeth, then everything you're talking about gets implemented.
Well, sure. And, there's even in whitening products, there are remineralizing agents. And part of that is to decrease the sensitivity after post-whitening. So some clients, I know when I whitened my teeth, I had extreme sensitivity and had to, really step up and use additional fluorides. But now some of these whitening, like day white, night white, have ACP in them.
And do you think any of those whitening toothpaste, like Bob Ibsen's Rembrandt, do you think it actually does slightly whiten the teeth over time,
slightly,
or do you think that's marketing?
I think it's a shade or two. It's not going to be extreme, but for some people, that's all they need. But most people that I see need a gel.
A gel. And when your son, if he ever grows up, gets married, and has a grandchild, when he comes over to your house, are you still going to have the candy bowl that all grandmas have?
Unfortunately, I noted for I did have a candy drawer. But,
you do?
I did.
Is it all a bunch of xylitol candy?
No, it's not. It's the regular. I try not to eat candy, but it's the regular thing. But I made every kid who slept over, and there were a lot of kids who slept over at my house, brush their teeth before bed. And they would come to my house for the weekend with no toothbrush. And I'd say, hey, I got a toothbrush upstairs. We're going to use it upstairs. I'd make a brush after dinner or before bed. And they would say to me, do I have to brush my teeth again? And I'm like, yeah, you got to brush again.
I only got you for a minute left, and I'm embarrassed to ask this question. It's a grotesque question. It's a foul question, but nevertheless, it's all over social media. That if your toothbrush has to be 20 feet from the toilet because the research is showing that when you flush a bowel movement, fecal matter is flying through the air, and they've isolated it on toothbrush, and your toothbrush can't be in the same room. Now people are wondering, well, should I cover it? And then some people are saying, well, that'll make an atmosphere to breed bacteria better. Some are now throwing it in the drawer. Some are moving it to the kitchen sink, and some say it's crazy. What's your thoughts on toothbrushes and toilets?
Well, I've heard this.
That's what we'll name this podcast. We'll say Deborah Levin-Goldstein discusses toothbrushes and toilets.
Yeah, well, that's a good one. I know they teach that at the micro. Teacher teaches that, and all my students tell me that. Look, I will tell you some of the power brushers have little sanitizers. You can buy sanitizers for your toothbrush. They use UV light that will sanitize them somewhat. Yeah, I've heard that. I've heard that too. Mine is not in the same room. I don't know how much it matters, but yes, I've heard that many times.
And now we're at an hour, so I have to wrap this up in overtime. But I still want to tell. I still have to say something that I've been doing my whole life. The gold standard of kill is always going to be bleach. And every time they come out with any other ingredient, all the research compares it to bleach. Bleach is it. And and over the years, they've come out with all kinds of compounds, and nothing kills as much as bleach. And I had an old periodontist who, when I opened up in 87, I was 24. He was about 80. And he told me that he still recommends his patients take an 8-ounce glass of warm water, put 1 cap full of Clorox bleach over the counter into that cap, and then swish that for a minute. And he still said, nothing you guys will ever talk about will ever be as effective as a cap load of bleach in a warm glass of water. What are your thoughts on that?
I think bleach is a very good disinfectant, a very good surface disinfectant. I think it might be a little too harsh for the oral environment. I mean, we do have tissues, we do have enamel. Enamel's not replaceable, so once we lose it, I have never swished with bleach. I like to use bleach as a disinfectant in my toilets, but I've never used it in the mouth, or I've not recommended it in the mouth.
Huh. Well, hey, you said enamel's not replaceable, and I just want to say either or you. You're an amazing, amazing person. You're a student of the literature. You're a registered dental hygienist. You have your master's degree. You're just an amazing, amazing person. Your 2 courses on Dentaltown, non-cancerous oral diseases, that every dental professional should know, is a must-watch. Actually, you got to watch that in the office. That's a lunch and learn, because your hygienist got to sit there with you, and you all need to talk about it. And repair and protect enamel with remineralizing agents. That's the whole office has got to be on there, because you never know in the dental office who those patients are going to ask clinical questions. It may be the assistant, it may be the hygienist. Sometimes it's to the receptionist. And the whole office. You've done so much for dentistry. You've done so much for Dentaltown. Deborah, thank you so much for spending an hour with me today.
Thank you very, very much for having me. It's an honor.
All right. Have a good day. Bye-bye.
Thank you.